Okay, I just did this whole video and the mic wasn't connected and there was no volume at all. So now I know what I want to say. We're going to talk about insurance today and why I think it's a scam, particularly health insurance, and why I canceled mine multiple years ago. And I'm so glad this is becoming more common now and that people finally understand, because I hated when I would try to explain to people why I don't have it and they would say, "What about in an emergency?" Well, here, I just ran through all the reasons why I didn't have it after I did. I had an engineering job for many years, like 3 years, and we had a really nice Blue Cross Blue Shield plan. Let me tell you what happened on that plan. I went to a nutritionist and they were paying for it for a while, the insurance. And then I guess there was maybe I ran out of the amount of sessions I could use, or something weird happened, something changed with it. And then her office was trying to like submit the claims under different codes to get it approved, and I was still seeing her while this was happening and nobody communicated anything to me. And then finally one day she's like, "Hey, you do owe me $1,000 before our next session. Unfortunately, your insurance hasn't paid for the last like five or whatever it was." And I was like, "Wow, I wish I had known this before it got to $1,000." And she was like, "Well, we were trying to fight it for you and usually it's successful," or whatever the reason was. And then I was like, "Okay, well, I think I am not going to come here anymore then, because that's insane, and I'll just pay it." So insurance didn't help me there. That was not very good. I did get to see her for multiple months before that happened, but like, I think it was the insurance fault that I suddenly it stopped getting covered and it was unclear, and then I was just stuck with this bill that I was totally not expecting. The next thing that happened was I always book my annual exam multiple months in advance so that I can make sure I get in before I run out of my year's worth of prescriptions. I take 3 different prescriptions. And so I called to do that, or like went online to do that, and they didn't have my normal provider. And for whatever reason, your normal provider gets marked as your primary care provider. And I'm like, "I've only seen this lady twice, but I guess she's that for me." And then I was like, "I'll just pick someone else so that I can get in before my prescriptions run out, because it sucks when I miss days." And so I picked someone else, and up until this, insurance had always paid for my annual exam. Well, my annual exam was with a new person. Apparently, that gets filed under office visit instead of annual exam. Even though they can still do all the functions of the annual exam, they check your heart rate, they make sure you're like not actively dying, and then they renew your prescriptions, and it's essentially the same thing. But for whatever reason, it has to get filed under this other code, which then means insurance does not have to cover it, which they did not. Which I was like, huh? Clearly, this is my annual exam. It happens every January. This was in January. I got my prescriptions renewed. We didn't talk about anything else. And they were like, "Well, because it's a new provider, it's an office visit, and that's not covered." And I'm like, "This is such bullshit, dude. What?" So, that really was not great. Then I changed jobs. I started working at Pizza Hut. Um, they also had Blue Cross Blue Shield. I got the slightly lower level plan because Pizza Hut does not help to pay for your health insurance at all, so it was like 300 a month. But I was like, "Okay, maybe that's good because at least I'll be covered in an emergency." Well, guess what? An emergency did in fact happen. I got a UTI that traveled to my kidneys, and then once I went to the ER for it, when they finally got me in and saw me, they were like, "If you had waited just a few more hours, you probably would have died because this was so close to getting into your blood." And anyways, the bill for all that was like $6,000. And when I called my insurance to see why they weren't helping, they said, "Oh, well, um, we don't cover emergency stuff." And I'm like, "What do you mean, dude? That's like the whole point of having insurance. I don't have insurance to pay for a $300 annual exam. I have insurance in case I have a multi-thousand-dollar emergency, such as this." And I was like arguing with them. And then they were like, "Oh, we'll cover a couple $100." Huh? That's not helpful either. And so I called the hospital and I was like, "Hey, dude, look, I have insurance. I had no idea this was going to cost so much. Like, is there anything we can do to reduce the bill? Or, like, do I really have to pay this?" And they were like, "We do have a grant for people with low income." Well, guess what? If you work at Pizza Hut, you have a low income. So I actually qualified and they covered my bill. But, like, what the fuck? I was about to have to pay $6,000 out of pocket for the whole entire emergency bill and still pay my premium every month? Huh? Um, Maybe it was something about the deductible. I don't know. But, like, that's a whole other thing that's insane. So now let's talk about math. If I were to get insurance right now, my premium every month would be at least $300 for me, one person. That is $3,600 a year before deductible or anything else. Now we're going to talk about my actual expenses. My therapist, after COVID happened and then they allowed video call and then they stopped allowing it again, and I was like, this is dumb. Video call is so much better. And then she was like, we could just not use insurance. And I was like, what do you mean? Wouldn't that be expensive? And she was like, no, it could be a hundred a session. And I only see her once or twice a month. So I was like, okay. And I think that's kind of like how much the copay was anyways. So, okay. Um, so I see her, let's say, worst case, like if we're really working through stuff, twice a month. So we'll go with that. So that's 2,400 a year. Totally worth it in my eyes. I guess I could stop and my life wouldn't fall apart and it would be fine, but I do appreciate that. Okay. And then I have prescriptions. Well, actually all of them together for 30 days, or not 30 days, 3 months. So I take 3 different ones. I take um, an antidepressant for my anxiety. That is 15 for 3 months. And then I take something for my thyroid. That's also like 15 for 3 months. And then I take birth control, and that's like 30 for 3 months. So that's 60 every 3 months. That's 240 a year. Now we're up to $2,640. My annual exam is about $300, if that's all it is, an annual exam. If they decide to do blood work, we're adding $600 because I'll get the full panel while I'm already getting a needle shoved in my arm. So let's split the difference and say we do blood work every other year. So that'll be 300 plus half the blood work, which is another 300. So we'll call that 600. Okay. So we got 2,640 plus 600. Now we're at $3,240. What if something happens? We're going to go with, we have to go to urgent care twice a year. That's extreme. I barely ever do anything, so I don't really get hurt or whatever. And like when I'm sick, I just stay home and recover. I don't understand why people go to the emergency room and urgent care for the flu, but what do I know? Maybe I'm privileged and healthy, whatever. We're going to say we go twice a year and it's $300 because actually urgent care visits are about the same as regular doctor visits. So let's add another $600 for that. So now we're up to $3,840. Altogether, for someone like me who has multiple conditions that need to be monitored by a doctor at least once a year and has prescriptions, and has mental health stuff. I go to therapy. I can do all of that for less than $4,000 a year out of pocket with no insurance. Why would I pay for insurance then? And now I got to have the headache of, you can only have 4 therapy sessions per year that we'll cover, and then you're like out of luck. Well, that's not going to do anything for me. And like, I don't know, dude. It's just a pain in the ass. It's not worth it. Like, just pay your own way. Do your math. Like, do the math. Also, we are not even talking about deductibles. I don't know how high most deductibles are, but like, I certainly wouldn't meet mine, so all of my stuff would be like I would pay at least what I'm paying now and have more of a headache and then have uncertainty about how much is this thing going to cost every time I go to the doctor or a therapist or anything. Like, I really like how it is now. I just pay out of pocket, and of course I get all these old people in the pharmacy and the doctor's office are like, "Oh my god, you don't have insurance? Are you okay? Are you unwell?" And I'm like, the system's broken, but we don't need to talk about that. I am paying my own way. Thank you so much for asking. Uh, it very when are you getting married and having kids? It's very out of touch from these older people. But yeah, do your math, see what your actual expenses are, and you might be surprised how much you could save by not having insurance. Also, pro tip, I haven't done it. I can't confirm, but I've heard from multiple people that if you go somewhere and incur a big medical bill, such as going to the ER, and you just don't pay it, nothing bad happens. You just don't pay it. Like, especially if, okay, there's two scenarios where that would probably be fine. This is not advice. Don't follow my advice. I am just being theoretical and speculative, and like, this is not legal advice, and I didn't tell you to do anything. Thank you. I'm not a doctor. I'm not a lawyer. Okay. um, Either you already own a house and a car, and you don't care if it hits your credit to not pay a bill, or you like maybe have a car, but you're like, how the hell am I ever going to own a house? I barely afford my rent. And then, like, either way, does it matter if your credit gets hit? Also, who cares about credit? Like, just if that's the only thing that's bad on your credit, does it really matter? I don't know. Look into it more. Don't make any decisions based on this. But, like, if I ever have to go to the emergency room again, I am not sure if I'm going to be paying that bill. I'll apply to that grant. But if they're not covering it, I don't know if I will. Like, that's crazy. Anyway, that's my opinion on the healthcare system. Yeah, the less people that have insurance, the more pressure the insurance companies will feel to change something and maybe make it affordable again. If the rates were half, maybe it would make sense for some people. But I think right now it doesn't make sense for a lot of people unless you have like a really crazy chronic condition, like you got cancer, you got to go to chemo every week. Like it's got to be pretty insane for it to make more sense to have insurance than not. Like it and the only reason I see people having it anymore is this like moral thing. It's like they feel like it's unmoral or unethical or something like that to not have health insurance. Like that's so crazy. Like you can't go to the doctor unless you have insurance. And like especially people with kids, they feel so guilty like if they don't have insurance. And I'm like, it's not about if you have insurance or not. It's about if you're taking care of your kid, if you're paying out of pocket to take them to the doctor when they need to go. Who the fuck cares how you're paying for it? Like just some thoughts. Thanks for listening.